we'll kick off with just a couple of introductions. So first off, I'm going to introduce myself. My name is Krista McIntyre. I am a registered physiotherapist here in Ontario. I've been with Lifemark for 13 years and 15 as a physiotherapist. I have a specialty training or advanced training in vestibular rehabilitation. So both Sheelah and I hold a certificate in vestibular rehabilitation, and we're here to share with you our expertise and knowledge around this area, hopefully answering some questions about why dizziness is so stubborn. And we'll definitely be sharing with you at the end of tonight's session about how you can get in contact with our clinicians who are experts in this area. I do have the pleasure of sharing our virtual stage tonight with the lovely Sheelah Woodhouse, so you'll all see on your screen. Sheelah is a graduate of the physiotherapy program from the University of Alberta back in 1991. Sorry, Sheelah, I probably should have held the year for you. And vestibular rehabilitation soon became her primary focus and her passion. She has pursued extensive postgraduate education in this field, including the certificate in vestibular rehabilitation in 2000. She also holds an advanced certificate and now serves on the faculty of the gold standard annual vestibular competency course at Emory University in Atlanta, Georgia. She is also the co-author of the clinical practice guidelines for vestibular rehabilitation and the past president of the Vestibular Disorders Association. She also has the distinguished job of being the key trainer of all of the vestibular therapists here at Lifemark. And so we're very fortunate to have her expertise and to share her expertise with you as well. So we'll get our session started off here. So I have a few questions to kick us off, and then we will be looking at what's coming in from the field, Sheelah. So the first thing that I wanted to do is just for anyone who has joined us tonight who doesn't know what the vestibular system is, or doesn't know what we mean when we say vestibular, or what vestibular rehabilitation is, can you just give a brief summary of what the vestibular system is and what vestibular rehab is?
Sure, certainly. I'd be glad to. And thank you for that lovely introduction, by the way. And to the audience, like Krista said, she's certainly an accomplished vestibular therapist herself. So Krista, if you want to jump in to help answer any of these questions, please feel free. But yes, vestibular, that's not a household word. So it would probably be valuable for me to just explain a little bit about what the vestibular system is before I actually talk about the rehab, because that'll help with the ability to understand what we really do. So the vestibular system, when we talk about that, we're talking about the organs that we have in the inner ear, the vestibular portions of the inner ear, which are an amazing mechanism that allows us to detect even the slightest little head motion in any particular direction, any speed, as well as just it senses static head position as well. So anything that the head is up to, those inner ears are on it. They sense what's happening, and they should of course be agreeing with one another, and they send all that great information into specific parts of the brain. There's dedicated parts of the brain that are designed to interpret that input, and then those parts of the brain weigh it out against other parts of the brain's information about what you're seeing and what your body is feeling. And if that all makes sense, well, then the brain decides, okay, I get where I am in space, and this is what I want to have happen next. So I'm going to send these instructions out to my body to make sure that I don't lose my balance. And also kind of an interesting piece of this that people wouldn't necessarily think there's a connection with, but the brain also will send out instructions to our eye muscles. And that's what allows us to actually focus when our head is in motion. So if I'm looking at you guys and I move my head all around, I can keep my eyes pointed at you, and my little camera part of my laptop still looks nice and clear for me. If it was actually you in front of me, I'd still be able to see you clearly, even though my head is moving. So at anything beyond really slow speeds, you need your inner ears and your vestibular system in order to achieve that. Okay, so that's what the system is. It's the great sensors in our ears, and then all the central processing that happens in the brain, and then the instructions that our brain gives our bodies and our eyes so that we can stay oriented and balanced and focused. So in terms of the rehab around this, it's a very heavily researched field, well proven to work. It's not some sort of nebulous alternative therapy. It is very heavily researched. So in the rehab, what we do is we use really specific techniques to help the brain compensate. Fortunately, our brain has a tremendous capacity to compensate when there's mismatches or problems in the vestibular system. So the rehab actually teaches the brain how to compensate for these problems and work around them, so to speak. So in a lot of cases, it's not necessarily a fix for the underlying problem, but it's having the brain essentially cover up the symptoms for you. So even though the problem is there, you're no longer aware of it anymore. Now, there is one type of issue that is actually kind of a fix, so to speak, and that's a problem that can occur out in the inner ear where some of the crystals that we've all got out there can get, those little rascals can get into the wrong part of the inner ear sometimes. And that will give people a type of vertigo that we actually can correct. So that in that respect, there's a fix. But in most of what we do with vestibular rehab, it's teaching your brain to get a lid on your symptoms and cover them up for you. So the assessment itself, it's a very extensive assessment, or it should be. Here at Lifemark, we book an hour at least for one-on-one time for our assessment. And it also should, in my opinion, include the use of what are called infrared goggles. So these are specialized piece of equipment where you're wearing the goggles, you're in the dark, so you can't see or fixate on anything, but we're still able to see what your eyes are doing. So if you think back to a minute ago, how I mentioned there's such a connection between the inner ear and the eyes. Well, that connection can actually give us a lot of information about what's going on in the vestibular system. So depending on what sort of condition you've got, a number of them will make the eyes do certain patterns of motion that can give us all sorts of clues about what's happening, what's going wrong in the system. So if you're trying to practice without the goggles, you're really, unfortunately, missing a lot of key information. So that would be a big part of our initial assessment, is a battery of tests in these goggles. But then we also would certainly be doing lots of things like testing your balance, stationary balance, moving balance, seeing if that ear to eye reflex is working properly and allowing you to focus clearly when your head is moving. We can actually measure that. We would also see, do you have sensitivity to certain planes of motion or motion taking place around you? Also, the neck is sometimes involved, so we might go down that road in certain occasions. We'd be giving you lots of education, and also importantly, we would be screening for the potential of, gee, this isn't just an inner ear problem or a vestibular problem. There's some other flags coming up here that have me a bit concerned. Maybe we need to let the doctor know. And you know, vestibular rehab isn't going to work for every type of dizziness. Not all dizziness is vestibular by a long shot. If you've got dizziness from a medication interaction or a cardiovascular problem or something like that, then vestibular rehab is not going to be the answer. These are things that your doctor is going to need to look into a little bit further. So we would certainly be screening for all those things during the assessment as well. But certainly the vestibular system is a pretty common culprit when it comes to dizziness and imbalance, and particularly vertigo. Treatment-wise, that'll really just depend on what we find during our assessment. It's not a cookie cutter, everybody does these 10 techniques type of an affair. It's the research is clear that the more customized the treatment is, the more tailored to your individual findings and needs and goals, the better it works. So it would look like normally a combination of things that we do in the clinic with you, as well as quite an emphasis on techniques for you to work on at home as well that we would prescribe for you. Typically, it's a physical therapist, physiotherapist that would be doing this type of work, although you might occasionally come across an occupational therapist or an audiologist doing this type of rehabilitation or other types of medical professionals, but it certainly typically falls within a scope of practice of a physical therapist, although I might add that definitely not all physios or these other types of professionals have this sort of training in their undergraduate programs. I had nothing of this when I went to university, although like Krista said, that was some time ago, but.
I was a little bit after that, Sheelah, but we also didn't learn very much of it when we were at school. We definitely had to go and pursue that postgraduate training.
Yeah, okay. And then the other thing to be said about postgraduate training. Unfortunately, people should be aware that there is absolutely no standards around who can call themselves a vestibular therapist, what sort of training you need to have, what sort of competency you can demonstrate. It's a bit of the Wild West out there. So unfortunately, sadly, there is a lot of variability in what you might receive and the quality of care you might get when you see someone for vestibular rehab.
Not when you come to Lifemark, though.
That's right. I've trained all of our therapists, and I'm continually working with them to make sure they're all up to date with the latest research and techniques and so on.
That's great. Well, thanks for that, Sheelah. I know that was probably a lot of information for some of our attendees. Some of them, though, I know have probably been patients in our vestibular rehabilitation program. So hopefully that wasn't news for everybody, but definitely a great level set in making sure that we're all talking about the same language. So what I want to ask you next, and really kind of comes back to the title of our session today about dizziness being stubborn. Why do some people who get rid of their symptoms, they have dizziness, whether they come for rehabilitation or not, but their symptoms go away, but then they might come back again? So why might that happen?
There's certainly a number of possibilities for that, and it really depends on your diagnosis, what exactly you're dealing with. It's not necessarily that the rehab didn't work, but you might have a condition where just inherently it's something that's episodic or has a high tendency to reoccur. Sometimes people go into what's called a period of decompensation, where maybe they came through rehab, did really great, the brain got a nice lid on those symptoms, but then, they're starting to bubble up again a little bit on me. That happens once in a while. There's other conditions where our goal realistically with that particular condition might not be to achieve a totally symptom-free resolution at the end. It really requires a lot of education on the part of the therapist to help you have the appropriate expectations of what's going on here, and how long is this going to take, and what sort of symptoms, if any, am I going to expect at the end of all of this. Also, there can be quite a psychological toll of having vestibular issues, and that's absolutely natural. And unfortunately, sometimes that psychological piece can actually grow its own legs and become every bit as much of a problem as the original vestibular problem, and that's quite a common culprit for ongoing or additional symptoms that might bubble up down the road as well.
Yeah. And it's really interesting there is that you've kind of talked about a number of different possibilities. So I'm wondering if you can just take a little bit more time on each of those things to just tell me more about those things that can reoccur. So those conditions that you were talking about.
Sure. So I guess when I'm thinking about things that come in spells or episodes or events, the two of the real biggies for that are vestibular migraine, which is it's a type of migraine that just so happens to affect the vestibular parts of the brain, unfortunately, and gives you these sorts of symptoms. Or else there's a condition called Menieres Disease, a little less common, but it also can come in these unpredictable attacks and spells where you can go a long period of time feeling fine in between these things, and then boom, there's another one. Menieres Disease is a condition where people deal with these sudden fluctuations in the fluid pressure in one of their inner ears. So suddenly, out of the blue, one ear is saying a totally different story than the one on the other side, and your brain just goes, whoa, I don't know what to make of that, and that can be pretty incapacitating. So vestibular migraine is actually becoming recognized as one of the most common causes of episodic vertigo, or not even necessarily vertigo, but episodic dizziness, or even just feeling a little bit off balance, and these strange spells that just come out of the blue. And with both of those, inherent in the actual diagnosis is the expectation that there's more than one event here. These are coming periodically. So even to be in the diagnostic criteria of having one of these conditions, that means that you get it more than once. So that could certainly be a reason why you're experiencing recurring symptoms. And so in those cases, of course, vestibular rehab, it's important to have the right expectations. Vestibular rehab is not going to fix those things. It's not going to stop these attacks. In those instances, it's really designed for helping you feel better between spells. So our role as vestibular therapists when it comes to vestibular migraine and Menieres disease is between times and giving you lots of education around those conditions so that maybe you can find something that is a bit of a trigger for yourself so that you can get a handle on the frequency of these events, not necessarily prevent them. With the rehab doesn't prevent them necessarily, but sometimes people can figure out triggers that can help with some prevention. So it's important to have the right expectations on vestibular rehab. You don't pull out your vestibular rehab exercises when you're starting to get a vestibular migraine or a Menieres attack and think that's going to stop anything. That'd be the worst time to try and do those techniques. So really, in terms of management of those conditions, it would be the rehab between spells, but then also a combination of maybe dietary or lifestyle changes if you can figure out some of your triggers. Often some medications can be useful in those cases, or other sorts of medication or medical management that your doctor might decide upon, or even in the extreme cases, perhaps even something surgical when it comes to Menieres in particular, in the extreme could be part of the mix when it comes to treatment there. Now, you'd also talked about things that reoccur. So absolutely, one of the things that is a very recurrent condition is that problem that I alluded to earlier where the crystals get out of place. So there's
a lot of questions in the chat, Sheelah, about BPPV, which is what you're going to talk about right now. So those of you that are asking about the benign paroxysmal positional vertigo or the vertigo that's related to these crystals that Sheelah's talking about, pay attention here because she's going to give you a couple little tidbits.
We could probably do a whole other talk on that.
We might need to based on the number of people that are inquiring.
Sure. So what happens with BPPV is like we talked about, some of those crystals can get into the wrong spot. And what that'll do is it'll give people little shots of vertigo when they get their head into certain positions. So it doesn't give constant vertigo or anything like that. It's people come in and say they, every time I roll onto my left side, whoa, the room spins and I hang on tight for about 20 seconds, half a minute, and it settles out and it stops. And then I'm okay. And then I go to get out of bed and there it is again. And so people with this condition have very specific head movements or head positions that gives them these little spins, brief spins. And as much as it's rewarding for us to treat, because it is one of those things that we can actually fix typically if we can figure out which ear is involved and which canal the crystals are in, and then from there figure out the most appropriate treatment. And the goggles are very helpful in that as well, I'll mention. So it's rewarding to treat, and it is one of those very few quick fixes out there, but it does really have a tendency to recur. There's been lots of research, of course, into reoccurrence rates with BPPV, and they've all got slightly different numbers, but all in all, you're looking at anywhere from a third to a half of people that will get this condition again once it's reared its head. So
and it can reoccur like really short and close together, right, Sheelah? Or it could be, there doesn't seem to be any rhyme or reason to the frequency or how far apart those episodes are.
Yeah, you're right. I mean, we can treat somebody and yay, they're so happy, the vertigo's gone, they're feeling 100%. And then 2 weeks later, darn it, I rolled onto my side and that spinning is back again. Or we'll see people, you might not remember me. I came and saw you 10 years ago, but I've got that same spinnies thing again when I get up from bed or whatever the case may be. So there is definitely a wide range there in terms of how frequently or often it can reoccur. There are a few variables that may increase your likelihood of reoccurrence. So just in general, that condition is more prevalent with age, but certainly reoccurrence can happen with age. If it started up as a result of trauma, most of the time BPPV comes just out of the blue, but sometimes it is a result of trauma. So if it had a traumatic onset, that tends to go with some higher tendencies towards reoccurrence. Also, if you've got any medical conditions that are just overall affecting the health of your inner ear, like diabetes or cardiovascular issues, where maybe the blood flow to that organ isn't terrific, that might lend itself to sloughing off these crystals. That's a bit theoretical, but that could be a reason why people get this repeatedly.
Yeah. And so that's really great, Sheelah. Just going to take a little bit of a sidebar. I'm wondering if you can just take like the briefest explanation. There's a bunch of people who are just saying, can you clarify what the condition is called and what the crystals are composed of, and are they normally there?
Great questions. Awesome. And I love talking about BPPV.
I know.
So I'm happy to answer this stuff. So what was the first part of that question?
Just clarify what it's called. So
benign. BPPV, yes. So BPPV stands for benign, which means it's not going to kill you. Paroxysmal, which means like a sudden burst of something. Positional, which means it turns on and off with different head positions, and then vertigo, which is an illusion of motion taking place that shouldn't actually be occurring. So the crystals are, yes, yeah. They're made of calcium carbonate, and you are supposed to have them. We all have them. They're in part of the inner ear. That's a fascinating little mechanism where we've got some little hair cells in there that stick up into a layer of gel, and then embedded in the gel are where all these little crystals are. So they're heavy, and so what that organ is able to sense for you is if you start tipping over even just the slightest bit, the weight of those crystals are going to bend the underlying hair cells. Or if you're stopped at a light and you start to accelerate or you decelerate, or if you're bouncing, any of those things are going to move those crystals around. And that instantly will give your brain information about, oh, hey, here's what my head is up to. So they're supposed to be there. We're very lucky that they're there, or we wouldn't be able to function. But as mentioned, sometimes some of them can start to slough out of that gel that normally holds them in place. And if enough of them start to accumulate out into, actually, I've got a labyrinth right here. So here's your inner ear. So the crystals are normally in these little ball-shaped chambers in the middle. And then if enough of them get out into one of these three tubes out here, what are called your semicircular canals, then when you do a certain head movement, then the crystals are going to migrate in the canal. So say you're sitting there, everything's feeling fine. You've got some crystals that have managed to get down in the bottom of the canal here. Oh, I'm going to look up and see what's up on the ceiling there. And you look up, and then those crystals start to move. They're going to start moving the fluid that's in that canal. And that fluid should not move because of anything related to gravity. So it makes the canals gravity sensitive. And then this ear is going to be saying, hey, our head's looking up, our head's looking up, our head's looking up. And the ear's on the other side saying, well, we stopped looking up a few seconds ago. So what are you talking about? But as long as the crystals are still moving, that ear is still going to think that you're in the process of looking up. So for that brief period of time until the crystals stop moving, the brain gets this wild mismatch of information coming in. And it engages that ear to eye business we were talking about earlier, makes your eyes move depending, and each canal makes the eyes move in different directions. So that's how we can actually figure out where they are. But then, of course, if your eyes are moving, then so does whatever you're looking at looks like it's moving. So it gives you these little spinny sensations until the crystals manage to make their way down to whatever the new low point is. Crystals stop moving, fluid stops moving, the ear quiets down again. Both ears are saying the same thing again, and your vertigo stops. Okay, so that's basically the mechanism of what happens with BPPV.
That's great. Thank you, Sheelah, for that. And sure. I know there's lots of folks who are asking about that. So thanks. Okay, so we're just going to go back. So you talked about a number of different possibilities of why people's symptoms may reoccur and kind of come back. You talked about those BPV. You talked about those particular diagnoses. You mentioned when you were talking about that decompensation. So can you talk to us a little bit more about what you mean by that and kind of what that's all about?
Sure. Yeah, decompensation is kind of an interesting scenario. What can happen is maybe a person, say they had an inner ear infection that left behind some damage in that ear. Other ear's fine, brain is fine, and they went to rehab and did their homework, and the brain did a bang up job in covering up their symptoms. They got back to all their normal activities. Off they go, happy, and then say 6 months, a year down the road, something happens. Those symptoms just start to bubble up again. Hey, what's going on here? And so, I mean, the first thing would be to make sure it isn't actually something new. But if you feel like, yeah, these are these same old symptoms, then it's up to you and your vestibular therapist to figure out, okay, what's happened here? What's pried the lid off? And one of the most common, well, there's a number of things that are really common culprits for decompensation. But if something really stressful happens, for example, or you go into a period of intense fatigue for some reason, or maybe you get a new illness that maybe completely unrelated to the vestibular system, but some other chronic illness or sudden illness. Maybe you get another little thing that goes on in your inner ear. Maybe a bppv kicks off out of the blue, and then not only gives you the positional vertigo, but also has decompensated that old inner ear insult from however long ago, and then those old symptoms are back again. Another really good decompensator is if you say you started a new activity or a new job, or you say, hey, I'm going to take up beach volleyball or something that just your brain has not had exposure to that type of environment or that type of challenge or movement or background since you had your rehab. So this is all kind of new stuff for the brain to sort out again. So that can sure decompensate people as well. So we would certainly help dig back. Hey, what's different right now? What's going on? Has anything changed? Have you tried anything new? And we'll see if we can figure out what maybe has rocked the boat a little bit on you. Another possibility, of course, would be if, say, you had to go into a period of reduced mobility. Ongoing movement and activity is really great for the vestibular system and helps to maintain your gains. So say you had to go into the hospital for a hip replacement or something, and you had to really lay low for a while. Maybe that was enough to tip the scales to allow some of these old symptoms to reemerge. And sometimes we can't figure out what's new, and we just need to deal with what's there at that point in time. But usually we can figure out something that's a little different in your life that might have been the culprit.
And that's so important. I think you were talking about kind of the really detailed assessment that needs to happen, is that we really need to kind of dig in and ask a lot of questions. So when you come for a vestibular assessment, you'll also spend a lot of time talking about kind of what's been going on with you to help us understand what's happening. The other thing that you mentioned earlier was the psychological impact. And so I'm wondering if you can just take a minute, and there was actually a couple people in the Q&A that were asking about anxiety, and could anxiety cause dizziness or vertigo and those sorts of things. So can you tell us a little bit about what the psychological impact of these symptoms, that, particularly reoccurring symptoms?
Mm-hmm. Yeah, well, certainly psychological things like anxiety and whatnot can have dizziness as one of the symptoms that it brings on. But if we look at it from the other end, from the vestibular side, it's really, really common with really not just vestibular conditions, but any kind of sudden change in your health that makes you have to curtail your activities, or makes it hard to do your day-to-day routine, or maybe you have to take a time off work, or you're having trouble caring for your family and you can't do your sporting activities, or anything that comes along like that really puts a crimp in your style. It would be unusual if it didn't have a psychological toll, really. So the vestibular system is so crucial for our basic function in our day-to-day activities, that when something's wrong with that system, boy, certain parts of the brain, they find this on research, certain parts of the brain just light up. Those parts of the brain that are involved in fight or flight, oh, something's really wrong, I gotta get out of this situation. Anxiety really gets revved up, and that's absolutely normal, particularly in the early acute stages of a vestibular condition or an insult. And then if that goes on for long enough time, it can start to spin into deconditioning and depression, and it can really become quite an issue. Of course, early on, really bad, say you got an ear infection and it's got you in bed for a couple of days with the room spinning at the beginning, absolutely you're going to want to avoid any kind of head movement, any challenge to your balance, any sort of stuff to look at. And that's, we certainly wouldn't expect you to push through exercises at that stage. But so avoiding symptoms in the early stages is supernatural. Not supernatural, but is very natural. But unfortunately, that hypervigilance around, oh, don't let your head move. Oh, don't challenge your balance at all. Oh, don't look at that. It's moving. If that persists for too long, it can become a huge problem all unto itself. And if you continue to avoid symptoms, the research is very clear that that really will slow down or even put a halt on your recovery. So that if that hypervigilance persists, it can become every bit as big of a problem as the original vestibular issue was. In fact, often long beyond the point of the vestibular system having much of a problem anymore that the brain hasn't already sorted out. That psychological piece can really grow legs and become a huge problem for people. It can be really debilitating. It's not a psychological condition. It's the psychological consequences to the vestibular condition. And actually, there's the evidence of changes that actually take place in the brain. So it's not just someone not sucking it up or anything like that at all. This is a very valid condition. It's got a name to it. It's got diagnostic criteria. It's called it's kind of a mouthful. It's called persistent postural perceptual dizziness, or we of course just shorten that down to 3PD or PPPD, triple PD. You'll hear it in a number of different ways there, but it is very much a thing. It's a valid and very can be a very debilitating condition, and it is a really common cause of ongoing symptoms.
Yeah. But a lot of people benefiting from vestibular rehabilitation with that condition, correct, Sheelah?
Oh yeah, the research is also clear that vestibular rehab works for that. I mean, really, the onus is on us as vestibular therapists to catch this early before it actually becomes 3PD, and that requires a lot of education, and so that you understand what's going on and what sort of symptoms you should be feeling, and that it's not a bad thing to actually inch into your symptoms a little bit and start to challenge yourself a little bit, because if that hypervigilance persists, boy, that can become a big problem. So the therapist should hopefully help you prevent that from coming on the first place, or if it's already full blown, then yes, vestibular rehab does work for that too. It's usually a lengthier process. And some help with medications and counseling can be really useful as a team approach around that as well.
Great, thank you for that. And I said it is, we could do a whole nother session on that too. So we might start having to make a list of the things that we need to get to. So I know that we have a lot of people who have joined us today who maybe have had vestibular rehabilitation before, because they've been patients of ours in one of our clinics. But what about if they feel like it never got rid of their symptoms completely? I think you've kind of mentioned a couple of different things, but should they really be expecting that, or what should they be thinking there?
Mm-hmm.
Somebody just said, please do more sessions. This is so helpful.
Oh, that's terrific.
Thank you,
Thanks
Judith.
for that feedback. Yeah. So where rehab didn't necessarily get rid of all their symptoms, absolutely that can happen. And in fact, in a number of conditions, certain conditions, it wouldn't even necessarily be an appropriate expectation that vestibular rehab is going to completely cure you of all your symptoms. It keeps circling back again to education and understanding your condition and having the appropriate understanding of how things should probably roll out in the end, so that you're not hoping for something that isn't realistic. So as an example, say you've got a problem that's damaged both your inner ears. We call that a bilateral vestibular hypofunction. So you might go to rehab and do all your homework and do a great job, and your therapist progressed you quite a ways, and then you eventually reached a bit of a plateau, but you're happy with where things are at, and we graduated, yay, discharge. But you very likely will find that, hey, you know what, every time I move my head just a little faster than my normal day-to-day activities, I still feel a little bit of a catch-up sensation, or if that ear-to-eye reflex isn't being driven by either ear, you might always feel like your vision slips a little bit when you move too fast. Or you might feel like when you get into a scenario where you can't use vision very well, like it's dark or really busy visually, Plus, you can't use the feedback from your body all that well. Maybe you're on uneven ground, or you're in the water, or you're on really thick carpet, or something like that. If you don't have the vestibular system in your ears as a backup, then you're going to be relying a lot more heavily on vision and that body feedback, that's what we call proprioception. So you will have the occasional scenario where you feel like, ooh, I'm not quite as, I don't feel as stable here as I would like. And rehab isn't necessarily going to help with every last scenario in things like a bilateral hypofunction. Similarly, if the problem isn't the ears at all, if it's those processing centers in the brain, then that can make rehab take a little longer and may not cover up your symptoms as completely as if the problem's just all out in the ear. An example I like to use on this is if you imagine a plane with a couple of propellers, and imagine that one of the propellers is having a little bit of a problem. The onboard computer can probably make some adjustments, and the electronics and so on can likely sort out something that's going to compensate for the fact that that prop is having an issue and keep the plane flying straight. But if the problem is the actual onboard computer, well, then you might be in a little bit more trouble. So that can alter our expectations with how completely people are going to reduce their symptoms as well, whether it's what we call a central vestibular problem versus a peripheral out in the ear problem. I would certainly say that another reason that people might not fully get rid of their symptoms, and I unfortunately see this occasionally, is I feel like people tend to stop their rehab too quickly before their brain has had a chance to fully compensate, and before we feel like as therapists we've given you everything that we can think of to help things along. And there's probably lots of reasons for that. Maybe you just got too much else going on in your life. It's just not the right time for you to commit the time and energy to a home program. And that's fine. I mean, let's face it, doing home exercises or home techniques, whether it be a vestibular issue or any sort of orthopedic physio, any kind of home exercise, it's a bit of a drag, I gotta say. But you gotta stick with it if you really are going to realistically expect that it's going to work. Let's face it. Another thing I think so often happens is that say your neighbor had that problem with the crystals. Oh, hey, I went to this vestibular therapist and they treated this once and boom, it was totally gone. It was like a miracle. I feel 100%. So you go in expecting, hey, I want that miracle too, but you've got something completely different than bppv. And then you find out, oh, what are you talking about? I thought you were just going to do something that's going to fix me. What do you mean I have to actually go home and start working on all these techniques, and then you're going to want to see me once a week for several weeks here? That's not at all what I was expecting. So, maybe that was just a instance of that you didn't feel like that's what you were signing up for. But yeah, really, other than the case of bppv, generally, we really do need people to be in a space where they can invest the time and effort into rehab, or else these residual symptoms are probably going to be there, and unfortunately sometimes unnecessarily. It's not that much different than, say, you want to learn to play a piece on the piano. You go to the piano teacher, hey, I want to play this piece. It's kind of complex, but I want to learn it. So, okay, they start teaching you, you get through the first few bars and they're giving you all these tips, and they, okay, that we've done enough for today. So why don't you go home and you keep working on that first page? So you go home and you practice and you practice and you practice, and it gets easier. And then you go back, okay, teacher, I think I'm ready to move on to that second page. And so they progress things and then fix your little maybe the mistakes you're making on that first page, and then this next section, it's a really challenging one, so we're going to need some extra work on that one. So you have to keep going home and keep practicing and then progressing, and it's a bit of a process, no doubt about it. And we absolutely rely on people to do their part of this with their home programs, and I know that's tough. And I know it's kind of a drag, but the little bit that we do, say once a week in the clinic, if you're not continuing to expose your brain to these techniques that help it to start covering up your symptoms once a week in the clinic is not going to do a thing for you. We really need you to be part of the team for this
that practice makes perfect kind of thing, right? Is you got to keep working at it.
Yeah, and it's a bit counterintuitive, really, because some of rehab actually involves pushing into your symptoms a little bit. And hey, what do you mean? I've spent the last 6 months doing everything I can to avoid making myself feel dizzy. What do you mean you want me to make myself feel a little bit dizzy? So that needs to be a little bit of a mind shift there to start to say, oh, well, that's interesting, to understand that actually the things that make you dizzy can also help you heal. That's like, oh, that's not what you would expect. But of course, that piece of pushing into symptoms a little bit has to be very gradual, very well controlled, keeping very mindful of not flaring you up beyond a very brief recovery time afterwards, and so on. So it's a bit of trial and error to get the right program in place such that you can nudge into those symptoms a little bit, but not so much that it really flares you up. And so that can be a challenge, absolutely, for people. And even that condition that I talked about earlier with BPPV, I keep referring to it as a quick fix. But even with that, it's not entirely uncommon for people to have a little bit of residual sensitivity to motion. My balance maybe not quite the same as it was. It's great, my vertigo's gone, so I guess I'm going to cancel my follow-up. But I'm still actually not quite the way I was before. And then that we could have helped you with those final bits, and got you back to feeling like you were before. So I think once again, sometimes people stop the process a little too soon before that your therapist maybe has given you all that they could have offered.
Yeah, so there's actually a couple of people who have had asked that question. I saw a little bit earlier. I mean, we have hundreds of questions, so I apologize those that we're not going to get to it tonight. But a couple of the questions that came in were, is BPPV something that you push through? And then the second thing, just kind of what you related to what you were just talking about, is can you be residually kind of off after the resolution of the crystal problem? So I don't know if you just want to elaborate on those two quick things, Sheelah.
Yeah. So the first one was that you just said,
pushing through the BPV.
Yes. So
or nudging your symptoms. Nudging your symptoms.
Yeah, that. Well, to be honest, before it was realized that we could actually get the crystals back to where they're supposed to be, the treatment for BPPV was that same kind of what we refer to as habituation approach, like we use with the rest of our rehab, which is that repeated exposure to the things that make you dizzy. Unfortunately, with BPPV, the idea of making, I'm going to turn to the right again, turn to the right again, turn to the right again, there's the spin again, there's the spin again. It's a really grueling process, and to bring on those spins over and over and over again, several times a day, day after day after day. Eventually, actually, it does work, but the odds of someone tolerating that and sticking with it is it's certainly absolutely not the way to approach treating BPPV anymore. Now that we know that, hey, that's not necessary, we can actually just get those crystals right out of there. And let's not worry about getting used to the fact that they're in there. So in that respect, I would say, no, do not be treating BPPV with pushing through it, even though, I mean, realistically, eventually it could work. But wow, that's a really unpleasant and undesirable way of going about it when so many better techniques exist.
Yeah, and then it was just the residual feeling of unwell or dizzy or off after the crystal problem being resolved.
Yeah, I mean, sometimes I think that perhaps, particularly if your therapist isn't using the goggles, there may be some crystals that are actually still in there that that are making you feel like things aren't quite there. It's way better than it was, but something's not right. So then one of the nice things with the goggles is it allows us to have such a good look at the eye movements that we can see even just this most subtle little hint that, oh yeah, I think there's still a little bit in there. So that could be one possibility. But even after we've got all 6 of those canals looking clean as a whistle from crystals, people can still have residual sensitivity to motion, often in the plane of the canal that was involved. And there is evidence that when you have BPPV, it alters your perception of upright. And then when we correct it, it actually alters it back the other way. It kind of overshoots a little bit. And then over time, and particularly with some of the exercises we can give you, it'll reset into the middle again. But residual symptoms are not uncommon with BPPV.
Yeah, for sure. And you can kind of think about it often too, is that if you've had it for a little while and that keeps happening, when you go to do that movement, you might almost like you feel like it's about to start and it doesn't actually go there. So you kind of might need to do a little bit of rehabilitation on that side too, just to kind of almost like retrain your brain back to what normal, feels like.
Exactly, because we talked about earlier how great the brain is at trying to compensate when something's mismatched in the inner ears. Well, if you've had BPPV for a long time, your brain has gotten real busy trying to get used to that weird signal coming in. So when it corrects, your brain has to reset itself, and that can take a little bit of time. And the treatment for that is not more maneuvers to treat the crystals. It's a whole different approach. So we would go down a different road to deal with those sorts of things. And in fact, one of the things, while we're talking about it here, one of the things that just gets my goat is if I have someone come in and say, oh yeah, I was seeing someone, I thought I had this crystal business, BPPV, and I've been seeing them twice a week for, I don't know, 6 or 7 weeks, and they keep doing these maneuvers, and I don't know, it's just not quite doing the trick for me. Well, if you're having to do a maneuver for BPPV that many times, then it's probably not BPPV, or maybe it's in and this can be challenging, but maybe that they didn't identify the right ear and canal and variant of BPPV. BPPV can show up in 12 different ways, so it takes a lot of doing to really figure out exactly what form of BPPV is, but that's crucial because that then dictates the right treatment maneuver. So it's a little bit more involved than it looks like on the surface.
Yeah, for sure. And again, another reason why those goggles are so helpful in, not just going to the default. Most cases are this, so we're going to try it this way, really kind of looking for those 12 different versions. So that's really great. Thank you for that, Sheelah. And I said, there's so many great questions coming in. And again, everyone who's submitting questions, please don't fret. We were going to look at them afterwards. We will post responses and share a summary of answers to questions, but there's so many great ones kind of coming in. So Sheelah, I know we're getting close to our hour and we did want to try to keep it under an hour. So I'm just going to say, what should people do now then? So they've got ongoing or returning symptoms, dizziness, vertigo, whatever it might be. What should they do?
Well, first thing I think I would recommend that people do is if it's just keep in mind, not all dizziness is from the vestibular system. So if these are new symptoms, if you haven't talked to your doctor about this before, remember, dizziness can be a warning sign for other medical conditions. So definitely make sure that your doctor is aware of what's going on, especially if it's accompanied by hearing changes or any oddball stuff like numbness or pins and needles or strange tastes or smells or trouble with forming your words to speak, trouble with choking and trouble swallowing, or your vision seems off and it's not just related to when you're moving your head. All of those things would probably be coming from something other than the vestibular system. So your doctor really should be part of the strategy of what to do about returning symptoms for sure. Having said that, if you're like, oh, this is the exact same old thing that I had last year, then I would suggest to return to your vestibular therapist if you did try vestibular rehab in the first place. Or if to be honest, if you didn't click with that person, maybe switch to a different therapist. I mean, that happens. Or if you think back and go, well, I really I actually only went twice before, and I really didn't do much of that stuff at home that they told me to do. So maybe just come clean with your therapist and say, hey, I'm having trouble again. I'd like to take another crack at this. Or maybe it's that stuff that you did with me last time. It really didn't work all that well. We really rely on our patients to come back to us with feedback of, this was too tough. It flared me up for an hour, or you've got me doing way too many things here. Come on, I've only got so many hours in the day. Or this exercise, I don't get it. It doesn't seem to be doing anything. I mean, we need you to work with us so that we can choose the right things out of the toolbox to give you the best results. And there is lots of tools in the toolbox. So if what we tried in one case didn't work, we can try something else, but you need to tell us that. So we would certainly reassess you, see, is this the same old thing, or is something new on the table? Maybe something's come up that's decompensating you. Maybe that psychological piece is rearing its head. So definitely check back in with your vestibular therapist once your doctor is aware of what's going on, would be my advice there.
There's a great question here, just kind of tied to what you just said. It just popped up on my screen. Is there any harm with vestibular therapy?
I can think of one condition where vestibular rehab would need to be put on hold until that was dealt with. There's a condition where people can actually get a flaw, a little hole in the membrane. It's called there's two forms of it, a paralymphatic fistula or a superior canal dehiscence. So if you've got fluid that's shifting through a little hole in the membrane, you wouldn't want to be doing a lot of really vigorous head movement. So, and if it's
those are conditions are pretty rare too.
Yeah,
Sheelah.
Super rare, and really only if they're in a real recent state could rehab maybe be detrimental. But there's really no there's no research showing an indication of adverse effects with vestibular rehab.
Great, thank you. I just thought tied in really nicely.
Yeah, that is a really great
talking
question.
about it. Yeah, and again, there's tons of other great questions. So I wish we had like 10 hours. So just before we kind of wrap up a little bit, I know there's a couple of people who are asking about how can we find a therapist, and we'll share that with you in just a second. But Sheelah, what would you say, like, what would be kind of your final advice, precautions for people out there that are listening to us?
Precautions make the internet pop into my head. There is so much misinformation out there and do-it-yourself kind of techniques that may not be at all appropriate for people. It makes me cringe sometimes when I see stuff on the internet. I mean, it's super important to get educated. Absolutely, understand your condition and understand what the appropriate expectations are going to be for your outcome and how long it's going to take and so on. But watch where you're getting your information from. One really great resource would be the Vestibular Disorders Association. The website for that is simply vestibular.org. And they're a nonprofit organization, and their medical advisors that vet all their information and their educational materials and so on are some of the best. So that is one place where you could actually go for it and feel confident that you're getting credible information. And in fact, if you do go to their site, this is Balance Awareness Week. Happy Balance Awareness Week, everybody. Balance Awareness Week is one of their main annual fundraiser, and they are a nonprofit organization who do an incredible job with educating and advocating for vestibular patients. And I can tell you for sure, they don't have big salaries and fancy offices and stuff. So any donation, if you find that their information is helpful, would be, I'm sure, greatly appreciated, and it would go a long way for them. So anyway, VITA is a good option. I would also recommend that people ask a lot of questions of their vestibular provider. Remember earlier I talked about how there's such variability in training and background and so on. So don't be afraid to ask, hey, I've heard about these goggles. Do you use those? Or, how often do you see vestibular patients? Is it just one little straggler every once in a while? Or is this a significant part of your practice? What sort of training have you had? Was it like a, half-day weekend workshop or a more intensive course of rehab or of education? I actually like to go to the clinic's websites. If the website doesn't say much about or anything about vestibular rehab being something that they champion, or if you go to the therapist bio on the website and it doesn't mention anything about vestibular training or doesn't seem like that's a particular passion of theirs, well, I thought for me, a few flags go up. But yeah, ask questions. Make sure you're with someone who you feel like, yeah, this person really, this is their passion, and they seem to know what they're doing here. Because you really need to find someone that you trust and you click with, because they're going to be your educator, your support, your cheerleader as you work your way through this type of challenging rehab. They're going to help you set those expectations about how long this is going to take, and how completely do you think I'm going to get over these symptoms. They're going to want your feedback on how, if something's too provoking or too easy. It's a team, and it takes some trial and error to get a program that really is a good fit for you. So definitely have that line of communication open. Don't be afraid to ask them the tough questions, and see it through. Stick with it, because this rehab really works if you and your therapist are on the same page and can really see it through. So I encourage people to consider giving this a try, or if you tried it before and it didn't really work, well, give it another shot, perhaps with a different therapist, and you should expect some results.
Great. Thank you, Sheelah. And I just put up on our screen just a couple different ways to get in contact or find a therapist across our Lifemark network. So we do have clinics across the country from coast to coast. The website for our information, where you can find a little bit more about dizziness and balance issues and vestibular rehabilitation, is on the bottom of the screen there. You can follow us at Lifemark Health on all the different social media channels. And then there is an email as well as a telephone number if you want to try to reach out to find a therapist near you. I will say that we have therapists in almost all provinces across the country, with the exception of PEI. Sheelah, am I missing anybody else? The territories.
Correct. Yeah, the territory.
But I will also say that don't be discouraged if when you go to look and find a location near you, and maybe there's not somebody right in your neighborhood. We have, before the pandemic, had just launched doing virtual care rehabilitation, and vestibular has been quite successful in being delivered in that way. So our therapists can provide care across any province. So if you happen to be in a part of Ontario or Saskatchewan or wherever you are, and there's not a clinic in close proximity to you, just look at the clinic within your province and find somebody who does have the training and the knowledge in this area, and then they can help you out with at least an initial assessment over our virtual care platform. It can be a video or telephone, but usually video is best. But we can at least help you try to get you in the right hands, the right people in your community to get you the care that you need. So I just want to be mindful of everybody's time. Thank you so much for everybody for your attention, for the great comments and feedbacks that are happening in the chat. As I said before, we do not have time to get to the hundreds of questions that have come in, though we appreciate every single one of them. Sheelah and I have earmarked some time over the next couple of days to be going through these questions and to make sure that we can share responses to as many of them as we can. Please go to our website. There's also lots of different blogs that you'll see that Sheelah and myself, as well as a number of our other therapists, have written. There was a bunch of people asking about concussion, and there's some great articles there as well. So please go and check out the resources that are available. We will be sending all of you who have attended an email afterwards as well with the summary information and the link to the recording. And we hope that you found this information informative for you. And we certainly love talking about this kind of stuff, Sheelah. So thank you also for being so willing to share your expertise with all the people here who have joined us today.
My pleasure. Thank you so much for people. I'm just astounded at how many people from all across the country have tuned in. I really appreciate it. And I will certainly get back to you with answers to your questions.
Great. Great. Thank you again, everyone. Well. Yeah, thank you, everyone, for joining us tonight. Please take care of yourselves. Enjoy the rest of your evening, and hopefully we'll see you all soon.